The Omicron variant is causing skyrocketing rates of COVID-19 infections in countries around the world. French authorities reported more than 200,000 infections in a single day. That's a new French and European record. The United Kingdom, Italy, and Portugal have all announced record numbers of new cases. And out east in Poland, authorities recorded nearly 800 deaths in just a single day, the highest number so far in that country. 3/4 of the deaths were unvaccinated people, the government said. And Germany says its official rates have dropped, but Health Minister Karl Lauterbach is skeptical that we're seeing the real numbers. He says they could be 2 to 3 times higher. And the Director General of the World Health Organization says he's extremely worried about the massive spike in cases that are driven by a simultaneous spread of Delta and Omicron variants.
Right now, Delta and Omicron are twin threats that are driving up cases to record numbers, which again is leading to spikes in hospitalizations and deaths. I'm highly concerned that Omicron, being more transmissible, circulating at the same time as Delta, is leading to a tsunami of cases.
And for more, I'm joined by DW's political correspondent, Emmanuel Chez. Emmanuel, so we've heard the coronavirus infections, for example, in France. They've hit a record high. So what is being done to slow the spread of the virus there?
Well, new measures will come into force on January 3rd in France. New measures to limit social interaction, to maintain distancing between people working from home will become mandatory at least 3 days a week, ideally 4 days when possible, wherever that can be implemented. It is no longer optional. Indoor events will be limited to 2,000 people and 5,000 people outside. This concerns sports, cultural events, but there will not be any cancellation on political meetings. This is quite significant, as you know, that France gears up for the new presidential election, the next presidential election in April. People will also be forbidden to stand inside restaurants, bars, cafes, with many professionals asking how this can be first feasible and then checked. There will also be a use of mandatory FFP2 masks being studied by the government, and a model of vaccine certificate similar to what Germany has introduced to attend public spaces and places of socialization.
And we also heard that here in Germany, Karl Lauterbach, the health minister, he thinks the numbers are actually a lot higher than what we're seeing. What's behind the underreporting?
Well, there's simply not enough medical personnel during the festive season here in Germany to test people and, above all, to communicate all the results, the test results, to the authorities. There's a staff shortage in the health system, and it shows not only when we talk about testing, with officials already warning that a collapse of the healthcare infrastructure in the coming weeks could very well take place here if the number of infections among medical personnel also increases exponentially.
So that's a grim case that you're painting there. Omicron cases, as we can assume, are higher than they are right now. They might be going up in the next couple of weeks. Does that mean we're going to be seeing a lockdown here in Germany?
So before this new wave of infections and the possible coming wave of infections before Omicron, officials from the former government had promised there would be no new general lockdown. But we see that at a local scale, curfews are being implemented and more restrictions, especially for the unvaccinated, are imposed in the worst affected districts. So yes, once the government will have used all other possibilities, such as mandatory vaccines, such as vaccine certificates to access all public spaces, well, then experts see a lockdown as something that should be on the cards, and it's something that Austria recently, or the Netherlands, have also already reinstated.
DW political correspondent Emmanuel Chez with the latest around Europe on the pandemic. Thanks very much.
Thank you.
And now developments elsewhere in the pandemic. Cuba plans to give booster shots to its entire population in January. That's a bid to prevent severe illness from the Omicron variant. In China, the 13 million inhabitants of Xi'an are in their 7th day of a lockdown, although so far no Omicron cases have been reported. Here in Germany, the International Development Minister says the country plans to donate 75 million more doses of coronavirus vaccine to poorer countries next year.
Here in Europe, France has recorded over 200,000 COVID-19 cases in a 24-hour period. That's a new French and European daily record. The Omicron variant of the coronavirus is fast becoming dominant on the European continent. Britain, Italy, and Portugal have also all announced a record number of new infections. In Poland, authorities say nearly 800 deaths were recorded in just one day, the highest number there so far. 3/4 of those who died were unvaccinated. Germany is seeing a dip in its official infection rates, but Health Minister Karl Lauterbach says the actual number of new cases is likely to be about 2 or 3 times higher than reported. Well, for more on the COVID-19 situation in Germany, let's speak to Dr. Uwe Janssens. He's the General Secretary of the German Society of Intensive and Emergency Medicine. Thanks for being with us. Dr. Janssens, Germany is surrounded on all sides by countries with soaring infection rates. Is this country due for a rude awakening too?
Yes, hello and good morning. I think at this point in time, we cannot provide any reliable data on the proportion of the Omicron variant in Germany. This is also due, like Karl Lauterbach, our health minister, said, due to the previous public holidays. Here, the reports are always clearly delayed. However, it can be assumed, I think, that the Omicron variant will certainly dominate in January, like in the other countries, like Great Britain, like Norway, like Denmark, like Portugal. And this means that, like in other countries, the named countries, we can expect significant number of infections. And currently, 10,000 infections with the Omicron variant have been reported. Here we are recording daily growth rates of almost 50%. Therefore, one cannot speak of a rude awakening at the moment.
Okay, so the picture doesn't look that rosy already. How are German intensive care units holding up to this surge in infections?
Yes, this is a very good question. At the moment, 4,170 patients with COVID-19 are currently being treated in intensive care units. Thus, the situation is currently, I think, definitely manageable at the moment. Nevertheless, we are, of course, very concerned with increasing infections from the Omicron variant and high number of infections following, the occupancy of hospitals and intensive care units will also increase again. And fortunately, the hospitalization rates reported from other countries with the Omicron variant dominant is lower compared to previous waves. And nevertheless, infections among employees can lead to bottlenecks in the staff and thus increase the burden even more.
Dr. Uwe Janssens, thank you very much.
I thank you.
Russia has tightened restrictions for foreign residents and visitors planning long-term stays. Under the new law, foreigners living in Russia or visitors aiming to stay for longer than 3 months will be tested for a list of conditions, including COVID-19, HIV, syphilis, tuberculosis, leprosy, and drug addiction. Several multinational corporations operating in the country have criticized the new regulations. Well, for more, we're joined now by journalist Felix Light in Moscow. Felix, what's the idea behind tightening these medical checks for foreigners?
Well, to be quite frank, there's been some confusion since this draft law was published. It's due to go into effect just with the new year. And, it was kind of a sweeping decision because health checks have always been part of the Russian migration process for those seeking permanent residency permits. But to extend it to this extent, it was quite extraordinary because not only do we have sort of essentially all foreigners minus diplomats and tourists covered, but we also have children from the age of 6 being covered. And to remind the viewers, that entails children of 6 being tested for sexually transmitted diseases, which obviously, seems rather ridiculous. And in general, though, I think this almost seems as though it came almost by accident to cover most foreigners here. This seems to me and to many others to be aimed primarily at Russia's sort of large population of Central Asian and Caucasian migrant workers. More recently, we've seen quite a sort of a turn in sort of negative rhetoric from the Kremlin with regard to migrant populations, especially in Moscow, and need to to employ more Russian workers. So it may be related to that. But to be quite frank, this is a very untransparent system, and we simply don't know the precise motivations for this law.
Being forced to undergo extensive health checks, as you've described, repeatedly, doesn't sound very appealing. What will this mean for those affected?
Well, I certainly think many in the sort of European and North American, perhaps, workers in Moscow are perhaps reconsidering their positions here. The German-Russian Chamber of Commerce has been very, very active in lobbying against these decisions. And just today, they said they'd secured sort of clarification and a slight sort of weakening of some of the impositions. But I think certainly for many sort of big European companies, which, even despite the substantial decline in economic links between the EU, between America and Russia since the annexation of Crimea in 2014 and the imposition of sanctions related to that have restored that have retained, I should say, their economic links to Russia, there does seem to be a reassessment of those links, a bid to sort of move staff away from Russia and perhaps to sort of more Russify, as it were, their representations here, because this is obviously, not a particularly attractive proposition for many managers and specialists who might be tempted by jobs in Russia at the moment.
Okay, so foreign corporations obviously don't appreciate this, but how is the announcement going down among the Russian population itself? Is there broad support among the people in Russia for this move?
I mean, I think, you can't really remove this from the broader context of where Russia is at the moment. There are any numbers of problems in Russia right now, from inflation through to political repression. And, to be quite honest, the of migrant workers, whether that's from Central Asia or from Europe, are not at the top of anyone's agenda in Moscow, I'm afraid. So this is very much a sort of an expat issue, as it were.
Felix, thank you so much. Journalist Felix Light there in Moscow.